afternoon, I'm Dr. Charlene Balili, and I am an endocrinologist. So today, I will be discussing to you on avoiding diabetes when it runs in the family. So first, let us define what is diabetes. So diabetes is a metabolic disorder characterized by elevated blood glucose levels or blood sugar levels. It is classified into type 1, type 2, and others. The best example for type 1 diabetes is Mr. Gary V. Okay? It is characterized by complete lack of insulin. So now, what is insulin? It is a hormone released by our body which decreases our blood glucose levels. Okay? So when you have complete lack of insulin, then you have elevation in blood glucose. What is type 2? Type 2 is when there is only partial lack of insulin and combined with defective insulin action. So what is the difference between the two? Type 1 has complete lack of insulin as compared to partial lack of insulin for type 2. Okay? So most often, patients with type 1 diabetes are managed with purely insulin therapy, and type 2 diabetic patients may or most often are managed with oral anti-diabetic agents. How do we differentiate between type 1 and type 2 in terms of clinical presentation? So for type 1 diabetic patients, these occur in younger people, less than 30 years of age. They are usually thin, and their presentation or symptoms is usually abrupt. Okay? For type 2 diabetic patients, they are usually relatively older, more than 30 years of age. They are mostly, but not all, are overweight and or obese. In terms of symptoms, they can present insidiously, meaning most of them may have had diabetes for the last 5 to 10 years without them having symptoms. Okay? And some may even present with complications at diagnosis. Between the two, type 1 and type 2 diabetes is more common. Okay? It occurs in 90% of patients who have diabetes. This is usually due to destruction of the pancreas, which secretes our insulin. What causes this destruction? It is not yet clear. There's not yet a way to prevent the progression of type 1 diabetes. Alright? Now, what is the role of genes? So if you have a parent who has type 1 diabetes, the child's risk of developing type 1 is around 3 to 4% only. Okay? But then again, we don't know yet about the other factors which can lead to overt type 1 diabetes. If you have parents who have type 2 diabetes, then the child's risk or your risk of developing type 2 diabetes is around 30 to 40%. Okay? Now, for the 30 to 40%, we cannot do anything about it. Okay? Because it's either been inherited or not. But for the 60%, this is mostly environmental or acquired. First of all, what are the risk factors for developing type 2 diabetes? One, as I said, genetics, which we cannot do anything about. Being Filipino, again, we cannot do anything about it. But the rest that I will say we can do something about, like for example, overweight or obesity, okay? Sedentary lifestyle, lack of exercise, okay? Hypertension, or having history of pre-diabetes. So most of us will have had at least one fasting plasma glucose in our entire life, okay? So usually when we are, or before we report to work or before we get employed, the companies usually ask for a fasting plasma glucose. Okay, it is a blood glucose taken in the morning after an 8 to 10 hour fast. So the normal is less than 100 milligram per deciliter. Okay, for you to say that the patient has type 2 diabetes, the value should be 126 and above. Okay, so the value between 100 and 125, it is called pre-diabetes, or in layman's term, borderline diabetes. Okay, I want you to remember this, no? Diabetes is a lifelong disease. So once you have it for life. It cannot be reversed. So before we label a patient as having diabetes, we definitely confirm our suspicion. For the pre-diabetic part, this is potentially reversible with lifestyle intervention. Lifestyle intervention meaning diet and exercise. different types of diabetes, and we also have the monogenic forms of diabetes. So there are types of diabetes which are not as common as type 2, which does not skip generation. Every generation has it. Grandparent, father, child, or mother-child. Okay? But others don't have a family history. So it can also skip generation, depending on the type of diabetes that you have. So based on the local guidelines, since patients may have had diabetes or may have diabetes without you knowing it, so the recommendation is for those who have no risk factors, have blood tested, like at least with a fasting glucose at the age of 40 years. And then every year thereafter, if it's normal. Okay? So the recommendation, 40 years old and every year to detect diabetes because Filipinos are a high-risk population. Ideally, we advocate that you lose 7% of your present weight in 6 months' time, or for you to lose 1 to 2 pounds of weight a week by decreasing your total intake by 500 calories daily. If you have risk factors, you can do testing anytime. But for those who have no risk factors, like no family history, not overweight, okay, general screening should begin at the age of 40 and then every year. Yes, so exercise will help a lot to increase your insulin sensitivity. Okay? Exercise only, like I said, 30 minutes a day, 5 days a week. Okay, everything about since the mom had diabetes now and you're the caretaker, you have to know everything about diabetes, such as the complications, okay, including renal failure, if the patient has diabetic foot infection, skin care, dental care, and you also have to be educated about proper diet for diabetic patients and the risk of hypoglycemia. Hypoglycemia is when the blood glucose level goes down. Potentially yes. The answer is yes. Okay, but to what extent I cannot really answer. Okay, now if your mom had poorly controlled blood sugar during pregnancy, then it may lead to some congenital malformations, congenital heart disease, okay, which you may have had acquired. But most often, this is not that common. So there's also a chance that you did not get it from that time, from your mom being diabetic when she was pregnant with you, okay. So it may, or again, it may not be the reason. So that's all the time we have for today. So tune in again next week for another CMI TV Live. Again, I am Dr. Charlene Balili, and thank you and have a great week ahead.